This is the last episode of the season in our Oral Surgery Fight Club. Shoot me a message if you'd like to join or contribute. Contact info is found at the end of this episode. Enjoy.
Okay. Share screen. It was weird.
There you go.
Yeah, there we go.
Oh shit.
Just like 12. I just like 12 EKGs.
Everybody got a flash of that one. That was nice, Gene. Thanks.
Listen, they said we have to know ACLS and PALS really
Yeah, you
well.
gotta know
So
it. Yeah.
that's only 2 out of the 12 cases. So
Yeah. Well,
and we
Jones is
haven't
ready.
done much.
Yeah, he's ready for boards. He's ready.
I'll answer it.
Right. So you have an 80-year-old healthy male passes out after, for all intents and purposes of this, by the way, everyone's pretty much
7:37. All right, let's go.
okay. So you have an 8-year-old male passes out after IV placement prior to any medications. What are you going to do?
I'm gonna first tilt the chair back, put him in supine. I'm gonna so he's NPO. I'm gonna tip him back first, assuming it might be like a vagal-basal response, and potentially see if he has any recovery immediate, in the first 15-20 seconds. Otherwise I can use like smelling salts to see if that will kind of stimulate him. That would be my first step.
Okay. What else would you do if that doesn't wake him up?
If that's not waking him up, what's that?
So he has an IV in. So what else are you going to do?
Well, I would make sure he's hooked up to all the other monitors. I would be checking, make sure he has a patent airway, basically do the ABC. So make sure his airway's patent, make sure he has, see if he's breathing, take a blood pressure immediately.
Okay. So you hook him to monitors and this is what you see. And his vitals are as following. 30 pulse, he's hypotensive, and 95% room air. What are you going to do next?
So this is...
What rhythm is this?
This is wide complex QRS. So this is VTAC, pulseless VTAC.
So my understanding is thready means you have a pulse. So let's treat this as...
Okay, well, this is uncompensated for VTAC with hemodynamic complications.
Okay, so what's the next step?
We're saying he has a pulse, you're saying?
Yep.
For VTAC, I would couldn't do
so let's say you have one of your assistants go get
I would have to get the crash cart. Okay. Well,
right,
yeah.
the crash cart.
Yeah, you would. I guess you would hook him up. You would get the pads on. He would need to be. I was thinking you wouldn't do it, but he needs to probably be synchronized cardiovert.
Yep.
Synchronized cardiovert. But I would hook him up, and the EP or the AED can tell me that.
Okay. Do you know how many joules per kg you would cardiovert this kid with if he's 30 kilograms?
Well, I believe the AED would do that for me.
Does it?
Yeah. Well, I mean,
I actually don't know, but
because you can't set it, but the joule typically. Well, I don't know PALS, but normally it's about the first would be 100 joules for an adult. So I don't know the exact joules per
okay.
kg.
So you try cardioverting, it doesn't convert him back to sinus rhythm. What would you give? What medication can you give?
Right. I would probably then I would do adenosine.
Yep. Do you know the dosing for that?
I would do. I know it's 6. Probably. I don't know it off the top of my head. I don't know the mix per kg, but it'd be push.
Okay. You do that, and it still doesn't work, and now you have this. What's going on now?
This looks like it's progressing to this is polymorphic VTAC or progressing towards VFib.
Mm-hmm. So what would your next step be?
I would check a pulse and see if he has a pulse.
He has a pulse.
And I pushed the adenosine already.
Yeah, you pushed the
I would-
adenosine, it didn't work, and now it converted to this.
Okay, well, I would run the. I still have the pads hooked up. I'm making sure, seeing if it's reading anything to see if a shock's advised. It doesn't. Yeah, I would see if a shock is advised.
Well, if it's VFib, would a shock be advised?
It would,
Okay, so what are you gonna do?
but if it's VFib, I would imagine he wouldn't have a pulse. But I would personally, start compressions and shock as advised.
Okay. And then, so after 2 minutes of CPR and you shocked him, it now converts to this.
Okay.
What are you gonna do next? What medication?
Well, sorry, stepping back, I would have called EMS. I would have had someone call EMS at the beginning of this, once he went into probably VTAC. So I would hope that the EMS is on their way.
Sorry, I just missed, sorry, can you just repeat?
I would have, at the beginning of all this, once he went into VTAC, I probably would have alerted the activated EMS protocol called EMS.
Mhm.
But now this is asystole. So I would start, well, I would continue CPR, and on the second cycle, I would give epinephrine IV.
Okay, how often can you give the epinephrine?
Every other cycle. No, every 2 minutes you can give it.
And what dose would you give? Just the milligrams per kilogram guideline.
Yeah, I don't know it for pediatrics.
Okay. What are some reversible causes of cardiac arrest?
So you would be running through your H's and T's this whole time. So acid-base disturbance, hypotension, not oxygenating enough. So hypoxemia, toxins. So if he's over toxicity, hyperkalemia, hypokalemia,
Okay.
electrolyte disturbances.
Yep. All right. So next patient, you have a 5-year-old healthy male. He's undergoes IV sedation with some ketamine and midazolam for extraction of 3 carious primary teeth. So mid-procedure, he appears pale and clammy with the following vitals and EKG.
So yeah, he's in.
What are you thinking?
This looks like he's just sinus breathy. I would probably make sure that he's not if he's at 3 liters, make sure he's ventilating well. You could just keep giving him supplemental oxygen. And the blood pressure is a little low, but I probably wouldn't do anything IV, like give him any atropine at this point.
So despite the adequate oxygenation, ventilation, he's still Brady. He Brady's down to 55. What's the next step?
I would probably, I would start, is he conscious?
No, he's still sedated.
I would start giving supplemental, giving him, you can bag mask him, give him supported breaths, and I would probably give him a dose of atropine.
Okay, okay, and Brady's down to 40. What are you gonna do?
At this, I believe you start chest compressions on a younger patient, on a child.
Okay, so you do 1 round of CPR. He's still Brady with a pulse. What medication can you give?
Atropine.
Anything else?
Brady with a pulse. I mean, you could give glyco. You could give. You could give. If he's still a little hypotensive, I guess you could give some phenylephrine. Or sorry, ephedrine.
Okay. So you look up at the monitor and now you see this. Oops, sorry. Now you see this rhythm. What's going on here?
He is in heart block.
What kind?
This is a type 2 heart block.
What are the different types of heart blocks?
There's 3 different types: type 1, type 2, type 3. Type 3 is complete disjunction of the P and QRS complexes. Type 2 is you have class 2 type 1, which is I believe it's the same PR interval followed by a dropped complex versus type 2, which is progressively longer. PR intervals followed by a dropped, which this looks like this is class 2 type 1.
Okay, so what medication can you give for this?
Type 2 Fallon. For heart block, you can
Well, he's still Brady.
Yeah.
With a pulse. So what can you give?
Not atropine. I don't know.
Okay. So now you have an adult, a 26-year-old gal comes in for a wisdom teeth removal. She complains of feeling a bit lightheaded. You throw on some monitors on her in the office, and this is what you see.
Oh God.
So she's.
What kind of rhythm is this?
This is SBT. I would try any type of vagal maneuver. Particularly, I would try just putting something cold, like a cold compress on her forehead and over her eyes. That would be my first initial treatment to try to see if that will break the SBT.
Okay. So your vagal maneuvers, the cold compresses, they don't really work. And you still have this rhythm. What can you try next?
If the vagal maneuvers aren't working, then you can do you can do medications. You can do I think it's adenosine.
Do you know how much you give?
6 milligrams.
Okay. Now went from feeling lightheaded to about to pass out, and her vitals she's very hypotensive. What kind of rhythm is this?
This looks to be a flutter. This looks to be a flutter. No, sorry, AFib.
I guess regardless, what would you do next?
This is still a SVT type pattern, but now she's cardiovascular, or she's compromised with blood pressure. I would hook her up. I would hook the EK. I would activate EMS, and I would also hook her up to the AED.
Okay, and what would the AED do?
No, I don't.
Are-
Or
Are you going to
Amio.
cardiovert or are you going to defibrillate? Synchronized cardioversion or defibrillate?
It would be synchronized, but it would be synchronized because she has a pulse.
Okay. I think time is over.
Or
I have one
amio-
more, but I feel like it's
amiodarone.
Yeah, that time is definitely over. You're like 3 or 4
Wow,
minutes over.
that was actually really good. I haven't.
Yeah, that was an insane
What's
case.
the last case?
No, I need to.
well,
Study this
honestly,
on
I was
Sunday.
going through this and I learned so much myself. So it was like super helpful putting this together to me.
I
The
need to
last
look that
case
stuff
was
over.
so apparently for like in the past they've put 12 lead EKGs on for STEMIs.
Yeah.
So I was like, this is like what I found. And apparently if you see like at least 3 or more with elevated ST segments, it's considered
Mhm.
STEMI, even if you see like reciprocal inversions.
Well, I would call that like an anterior infarct. I mean, I don't.
Yeah. So like, don't get confused if you see some inverted. Like
You're talking about like the ST depression in 2.
exactly, yeah. Or like 2, 3 AVF. So
So you're saying it's instead don't look at that, look at the STEMI.
yeah, so I just like looked up what the criteria is. If it shows up in 3 consecutive leads, so like V1, V2, V3, for example, at ST elevation, it's a STEMI.
Got it.
It overrides whatever like depressed ST segments you see.
Yeah, because the depressed ones, that's just because of the vector of the
Yeah.
electronic problem.
Where the current is
If
traveling.
you look at the Brugada protocol,
Is that a car?
Brugada.
Oh, is that the one that's like the 2 millimeters above or something?
I don't know what it is, but I just remember them talking about it.
Sudden death syndrome.
That's a good deep pull. It doesn't remember how to treat AFib, but let's pull up the Brugada protocol.
Yeah, I need to look at ACLS.
Yeah, I think we all had a moment where we.
I guess
were like, shit,
looking
we
back
gotta
on
look
it,
at ACLS.
yeah, looking back on it, I should have given metoprolol, but yes, okay. Or amio.
The only
Um,
thing with kids is that you first start with epi unless it's like a heart block.
Yep.
So at
Can you-
at which point you can give atropine.
Got
Yeah,
it.
Gene, can you go back through this and just like,
Yeah, I think that'd be beneficial.
it'd be helpful.
I feel
to
like
go
you
through.
got most of it. So here you have
It's
this
the
is
8-year-old that
BTAC.
passed out after the IV.
this is had a pulse. So next step would be because there is a
So,
pulse, but
Going off that, in Nashville, they treated the thready pulse as a pulseless, though. I remember them doing that in one of the cases.
Hey yo, I gotta sharpen my swords for the oral boards. I learned them from Patel and he's the Lord. And I'm his protege, you know I'm gonna slay all these motherfucking questions today. Cause I got the sound bites, they're gonna make these old men go, ooh, ah, like some afternoon delight. Yo, I got these questions in my sight and I got the answers. Yo, my answers is so ill, they give you canker sores.
Thanks for tuning in to Oral Surgery Fight Club. For uncut episodes and sound bites, go to osfightclub.com.